So hi everyone, this is the second installation of our Physicians Perspectives series. The goal of this series is to get physicians to be able to come and speak about their journeys in medicine and why they chose a specific specialty. My name is Emmanuel Villalpando. My pronouns are he, him, and I am a third-year medical student at the DGSOM at UCLA. And I'm joined here today by my co-coordinator, Erica Bernardino, who is also a fellow medical student at the David Geffen School of Medicine at UCLA. So firstly, I'd like to go ahead and introduce some of our speakers. We have Dr. Sarah Gustafson. She is currently a pediatric hospitalist at Harbor UCLA and an assistant clinical professor at the David Geffen School of Medicine. She has been a lifelong Bruin. She did school as an undergrad. She worked at UCLA during her gap year. She went to the UCLA David Geffen School of Medicine. She went to UCLA Peds residency, and she's currently now chief resident, or she became chief resident, and she's now currently a faculty at UCLA. We also have Dr. Deborah Lehman joining us. She completed her pediatric residency at the CHLA Institute and her infectious disease fellowship at both UCLA and UCSF, where she studied research about maternal fetal transmission of HIV. In addition to her roles as a pediatric clerkship and chair and associate vice chair education for the Department of Pediatrics, she also enjoys bringing her therapy dog Hamilton as a volunteer for the UCLA People's Animal Connection at both Ronald Reagan Medical Center and the Mattel Children's Hospital. And we all enjoy the therapy fluffies. And then we also have Dr. Claudia Lau. She is a board certified pediatrician, chief resident, and clinical instructor at UCLA, serving as an attending at UCLA's resident community clinic at Allevue. She nationally serves as the American Board of Pediatric American Board of Pediatric Stakeholder Advisory Panel, the AAP Community Access to Child Health Program. And she's also in the process of mentoring several medical students and welcomes future mentees. And with that, I'm going to hand it over to my co-host coordinator to kind of begin the talk.
Hello, everyone. Our first question for the panel is if you can tell us a little bit about your subspecialty and what kind of responsibilities you might have or what your day-to-day might look like.
Hi, everyone. I guess I'll get started. It's so great to be in front of you and yeah, excited to hear your questions later. So I'm a pediatric hospitalist. So that means that I work in the hospital exclusively seeing children who both who are sick, anywhere from neonates, meaning like babies who are just born, to 21-year-olds, or sometimes even older in the setting of the COVID pandemic. And then I also see babies literally as they're born. So when a woman is pregnant and there's some risk factors that make it uncertain how the delivery is going to go and if the baby is going to need help breathing right after birth, I also am in that room to help, run the code if need be, and then taking care of healthy babies as well. And then in terms of, so I'm clinically based at Harbor now, and I see a lot of, we're a trauma center, I see a lot of trauma, but we take care of, one of the great things about hospital medicine is that you get to take care of all kinds of conditions. There's a ton of variety, and then I would say there's a lot of variety in my schedule as well. So from week to week, it changes. Right now I'm off service, meaning that I have a lot of time to work on projects and mentor and do great things like this. And then tomorrow I'm on service, so I will be completely devoted to my patients and the residents and students that I work with. So yeah, I will pass it off to Dr. Lehman.
Yeah, hey, that was great, Sarah. I want to come be you for a little bit. That sounds wonderful. So I guess backing up a little bit, thinking about the path to pediatrics, we all went, of course, did 4 years of undergrad, and then we all did 4 years of medical school. And sometimes that wasn't right after undergrad. For me, it was, but sounds like Sarah, not. And then Claudia maybe will tell us, but I did go right through, which in my day, which was a long time ago, was more typical. Now most students do take a gap year, or a couple gap years or something.
I took
And then
3.
or more. Yeah, I'll tell you that I met my husband in medical school, and I think he took 7 or 8 after his undergrad. So yeah, that was very unusual then. And then we all did 3 years of pediatric residency. Both Claudia and Sarah did a year of chief residency. I went on from residency to do fellowship. So that's another training program. That's another 3 years. And I specialized in pediatric infectious diseases. So for a long time, I practiced pediatric infectious diseases, and my dog is coming into the room. I pediatric infectious diseases, both first I worked at Kaiser doing that for a little bit. And then I worked at Cedars-Sinai, one of our affiliates. I was also down in Long Beach for a little bit. So different hospitals, but those were sort of academic positions. And I would see patients in the hospital for the most part, and a little bit sometimes in the clinic. And these were all patients who had infectious diseases problems. And you may say, like, what is that? Well, that's things like measles, chickenpox, maybe an infection of a bone or a joint, maybe bad lung infection. And then of course I trained in the 90s, late 80s and 90s, and there was a lot of pediatric AIDS, pediatric HIV. So that was then. I've shifted my career a little bit over the last 10 years. And I do now a lot of, as Manuel mentioned, I do a lot of medical education. So I now supervise all the pediatric education for our medical students at UCLA. So I do a little bit of clinical work just to keep my my hands wet, or I don't know what the expression is, my feet on the ground, something. But mostly I do organize sort of how we're going to teach pediatrics to medical students. And of course I depend on attendings like Claudia and Sarah to do that, and they do that so well. And so I guess I'll pass it on to Claudia, and you can tell us your path and what your day is like now. And actually chief resident, as you'll tell us, is just 1 year. So that's soon your life is probably going to change in a different way.
Yeah. So hi, everyone. I'm Claudia. I took actually 4 years in between college and medical school. Took quite some gap years, did research in public health during those years. And it's, I wasn't what they call pre-med during college. It's completely possible to do it even if you didn't take your pre-med courses in college. I ended up doing night classes to fulfill those pre-med requirements. And it turned out just fine. In terms of what I do on a day-to-day basis, as Dr. Lehman was saying, this year is a little bit of an anomaly as chief resident, which I'm sure you all know from Scrubs or Grey's Anatomy. It's more of a management and teaching year. And so depending on which, we rotate at 4 different sites, depending on which site I'm at, I have either 50% clinical time, meaning half a day of every day I'll be in clinic, teaching medical students and residents. Or for example, at this site I'm at right now at Ronald Reagan, our main UCLA site, I'm only in clinic for half a day a week. It can vary a lot once you go into more, I guess, administrative roles. For the remainder of my time, it's research management, answering pages for example, if a resident physician needs to call out sick, the hospital doesn't stop and it's 24/7. And so we're the ones calling people in for those shifts. Next year, I'm actually still looking for jobs to be a general pediatrician. And so that's the pediatrician that you've seen growing up, the pediatrician who you'll go to for your annual well visits in the clinic. That's what I hope to be. And that would involve being in clinic 4.5 days a week.
Sounds like a very busy schedule with the research and the clinical aspects together. And I think those are things that our pre-med students and our first years will learn more about balancing and getting involved with.
The next follow-up question is if you can speak a little bit more about what you did during your gap years, if you took them.
I loved my gap year. I applied to a bunch of different jobs, and it was difficult to get a job, but then, well, I don't know. It felt difficult. I got the job in about August of my gap year. So as I was filling out applications, I was feeling nervous about not having anything, and was looking into, being a TA of some sort, applied to the test prep, and didn't get the job at the test prep place. And then I got a job at the UCLA blood bank as a technician. And the manager, I was completely upfront with her about, I can only do this, or, well, we'll see if I get into med school. At the time, I wasn't super confident that I would get in. But I let her know it was a possibility. If I did get into med school, I would be leaving in a year, and she was okay with that and hired me. And then I learned all of this cool stuff about transfusion medicine that we don't cover very heavily in medical school. So it was kind of a cool thing when I was on rotations at Reagan. I always knew I had friends in the basement. And yeah, that was my gap year. My gap year was also spent, like I said, filling out applications. All of you who are going straight through, I have a lot of respect for that because it must be really hard to do it at the same time that you're managing everything else with classes. But I guess maybe some people would say the same thing about full-time work. I don't know. But yeah, spending the time going on interviews and all of that is what I did with my gap year. I was tempted to apply for a master's instead, and I'm glad I didn't, and it worked out the way it did. But I know a lot of people who used a gap year to do that and were very happy with that. So that's another way that a lot of people use their gap years.
I guess I already spoke a little bit about my 4 years, I guess, gap years. I highly encourage it, actually. I find that applicants or, our residents who have had a few years of gap years have come to residency with a slightly different perspective once you've, had a real job outside of college and have had adult roles, no longer being a student. And correct me if I'm wrong, everybody else, but I think residency and medical school selection boards actually favor gap years. If, of course, if you do, if you're able to learn from it and get important life experiences from it, I'd like to say that we encourage it.
Yeah, I think that's right. I mean, as someone who didn't take one, and I, of course, I graduated from, college in the mid 80s. So it was a long time ago. And most people actually didn't take gap years then. You just sort of went right from undergrad to medical school. I mentioned my husband who took off many years before, mostly because he really didn't know what he wanted to do and then sort of had to circle back and do a post-bac. That's also really common. But that was definitely the anomaly. And now it's really, I think, the anomaly to go right through. And I think I would completely agree with Claudia that it's an opportunity. I mean, look, even what Sarah spoke to, I mean, the opportunity to learn something completely related but different than you're going to be doing for the rest of your life. And, you know, when I think about going from, you know, sort of preschool all the way to med school and then right into residency and fellowship. And then I finally took a breath. At the end of fellowship, I had my first daughter, and I took a breath, and it took 6 months after she was born. And I, you know, took some time off, and I kind of reflected back on that thinking, wow, this is like the first time I've had like not anything to, you know, I wasn't enrolled in anything or wasn't, you know, and it was amazing, but it made me sort of reflect on that. So I would totally concur with what Claudia just said about encouraging you to people to do that. I think there's a lot out there to learn from.
Yeah, I can totally second that. I also took 2 gap years, and I think a lot of my classmates took gap years, and there's also some people who didn't. I think our next question will be if you could talk about any experiences, clinical or non-clinical, that you found helpful to be a good doctor, either in undergrad, in med school, or in residency, or as an attending.
I think just thinking about the UCLA undergrad experience, I don't know, everyone's experience is different, but I selected biochemistry as my major when I went in, thinking, I love biology, I love chemistry, biochemistry, right? And so as you all know, PChem major, and I figured that out, but decided to stick with it. And I don't need to tell you, UCLA undergrad can be tough, particularly in the South Campus major. So I think, you know, it does prepare you in terms of, you know, the commitment, the long hours. I mean, everyone's experience is different, and like how the first year of medical school goes for you. And, you know, it's not quite the same as like being a good doctor, necessarily answering that question, but just reflecting on how things that seemed at first totally disconnected from what I would be doing in medical school, they did have a connection. And there is biochemistry that you need to know for sure in medical school, and to be a doctor too. I think I've always loved teaching. I've always loved learning, and I've always loved teaching. And I'm from a family of educators. And I think that the experiences that I had in undergrad, where I was volunteering and working with kids and teaching them something about science, or tutoring them or mentoring them, those experiences, and I mean, probably helped me continuing to pursue those, I think did help me have a coherent story to tell, like when applying to medical school. So I think that is important. Like if you're passionate about something that may not seem directly related to medical school, or like ultimately becoming a good doctor, it probably is in some way. And I feel like I'm rambling a little bit now, but I think
no, it's really, I think it's great to get the thought process. Yeah. We appreciate it.
Yeah, all of those experiences, teaching, I think help when you're at the bedside with a patient and a family, and you're explaining things. You learn how to explain things at different levels, and making sure that you're explaining things in a way that people can understand. And then of course, all of us are involved in medical education and very passionate about that. So it's cool that I can still do that in my day-to-day work.
Yeah, I think that's great. I would second all of that, especially the education part of it. I didn't know that I was going to end up having such like a big role in medical education, like a formal role, but I always knew going in that I wanted to do, you know, sort of blend that sort of teaching with the practice of medicine. And I think to the question in the chat, I think pediatrics lends itself to that, because I feel like we're, you know, children are developing so quickly, and there's so much opportunity to impact their lives in a way as providing that, you know, that link and education. I think, you know, one thing that was a big part of my life growing up is I was a camp counselor for many years, and I think that really prepared me for residency. I just like, the organizational part of it, the thinking on the fly, the not really knowing what you're going to encounter the next moment or the next day, and I don't know. I think that, when I was doing it in the time, it was just fun and it was outdoors and I loved kids, but sort of, it was, when, I hadn't really thought, but I think it was, and I think actually thinking about it, I think it was actually a big part of my application to either medical school or residency. I can't remember now, but, experiences that I had, with a cabin of 8 kids on a hike somewhere and, whatever. I think those are very, impactful experiences, but it's hard to know exactly. And I think, Emmanuel and Erica, you can probably attest to this. You don't really know what it's like until you actually dive in and you don't know what, I mean, going from the, even the preclinical sort of lecture part of medical school into the clinical part of medical school, that's even a bigger jump. And until you're in it, it's hard to really prepare for it, I would say.
I think working with 8 kids would probably be quite a handful to manage 8 at once. So I'm impressed, and I can see how it could probably give some assistance on the pediatric clinics and wards.
Yeah, I have, for me, the program that sort of kept me sane through medical school was a similar elementary school teaching program where we actually didn't teach anything to do with traditional medicine. We taught dance as a form of physical exercise and, sprinkled in maybe little tiny bits of health education facts, but it was mostly dance. And it doesn't have to be something directly related to traditional medicine to learn, I guess, bedside skills, bedside manner, to learn how to talk to children or how to control a classroom of 30 kids who are all dancing and bouncing off the walls. And I think that was definitely the program that that helped me see through the course of medical school and now to residency, and as an attending to remind me what I'm doing this for, is to help the kids.
And I see a question in the chat. Why did you choose pediatrics instead of adult medicine?
Someone else can go first this time.
I mean, I think I get asked that a lot. I think we probably all do. When I first started medical school, I was pretty sure I wanted to go into OBGYN. I wanted to take care of women. I was interested in reproductive health. And it was actually not until my 3rd year, like well into my 3rd year, I had pediatrics and OB right next to each other. I was down at Harbor, UCLA, where Sarah is. And I really just, I did OB first. And I remember being in the delivery room, and I remember the baby being born and wanting just so much more interested in like what was happening with that baby on the warmer. And I kind of knew then that that's where I wanted to focus. And then I went right into 6 weeks of pediatrics, and I just loved the people. And I loved taking care of the whole patient. I love the pediatric specialty that I chose, but I really love kids. Like Claudia and Sarah will attest to, kids are just so much fun to care for. They get sick really fast. They can get sick really fast, but they generally get better really fast too. They're incredibly resilient. And I do enjoy interacting also with their families. It's a whole family, sort of the family care. So I think we'll probably say similar things, but that was my path. It surprised me, but that's how I ended up in peds. Claudia, why did you end up in pediatrics rather than adult medicine?
You've said all the things I was going to say. During my gap year, the 4 years of research that I did was actually at a children's hospital with with the pediatrician as the PI or as my boss, and she was amazing. Everybody loved her, from the patients to the parents to the nurses or the front desk person. And I wanted to be her and wanted to help kids in the way that she was able to, both in the clinic and in the policy work that we were doing, and just affect change in kids. They're not able to, oftentimes not able to speak for themselves. And I wanted to be that person for them.
Yeah, I also came into medical school thinking OB-GYN or maybe adult infectious diseases. I was very interested in global health from the start of medical school, and that's like kind of why I was thinking that. But as I went through the preclinical years of medical school, I started noticing a pattern that all of the mentors that I really was drawn to, the people that I wanted to be in the future, they were all pediatricians, including Dr. Lehman. And then on my third year rotation, in my third year rotations, the clinical rotations, it was very clear that I loved hospital medicine and I loved adult internal medicine, and the discussions, talking about the different possibilities, the style of rounding, I loved all of that. And then I did pediatrics, and I had all of that, plus, like, not that I didn't love the mentors and internal medicine too, but I could just see myself, or hope to see myself in the future, being one of those pediatricians, one of those pediatric hospitalists. And then how I felt at the end of the day going home after taking care of children was just a little more joy. It's even when the children are sick, and unfortunately not all of them get better, but a lot of them do get better, and there's still years ahead to affect that change that Claudia was talking about.
I think we do have one question in the chat that I'll just read briefly, and it asks about research opportunities or lab experience. I know that in my own experiences too, that those are something really important. Do you guys have any advice about how to get involved early on, maybe at the undergraduate level?
I don't know. My information is a little bit old, but when I was an undergrad, we had like SRP classes, and you went on the website and searched for mentors. And then I sent a lot of cold emails, and eventually got a response. And it wasn't like my first choice, to be honest, but it ended up being the lab where, the PI wrote me a letter of recommendation for med school. I met some friends, like some of my best friends in life, in that lab, even though I'm no longer interested in that kind of research. So I think, unfortunately, and the exact method may have changed, but I think a lot of it is cold reaching out to people and then not getting a response from everybody, and being prepared if you do get a response, taking a look at the PI's research and having glanced at some of the articles and being able to, being prepared when they reach back out to you.
That's, I think, great advice, Sarah. I think what you said is so important that, I think if you wait for like the perfect thing to come along with, you're very interested in neuroscience and it has to be in this area, a lot of time will go by where you're really coming sort of batting zero. I think the important thing about doing research is sometimes less the actual project and more the PI is so important, the mentor, what is their track record with students? And it's really just about learning to think in a new way, learning to ask, to see how people around you are asking questions and what they're doing to answer those questions. And it may actually, we all did, some research, and I did research as an undergrad that I really can't even barely remember or was very even interested in, but it was the discipline that it sort of taught me what it was like to be in that wet lab, and how to get some skills and how the people thought and what the lab meetings were like and the questions they asked each other. And that was just as much learning as it was about how to pipette something or do a gel or all those things that I can't even do anymore. So.
And it doesn't have to be a wet lab. There's lots of clinical labs, or in my case, it was a public health research lab. And it's, like Dr. Lehman was saying, it's more so the process than the actual project. I also cold called many PIs, and that's actually how I got my first job that led me to medicine. She's now, she's still writing letters of recommendations for me 10 years later. And it's, you never know what kind of mentoring relationship you'll find with just cold calling. I think most of my mentors I found that way. You do have to be prepared to email maybe a dozen to get one response, but it's definitely worth it.
That is amazing. 10 years later, still to have that mentor, that is an amazing resource.
Your next question is, how do you all maintain your work-life balance?
And then to kind of add, it's were there any skills or activities or things that you might have started earlier on, like in your college or medical school years, that maybe stick with you or you still find useful or meaningful even today?
I feel like I'm too far away from it to remember really, because I'm not sure if in medical school I mean, I would say now, work will, I think, find us at every moment of the day, all the time. So I think it is important to think about how to, partition our days and our weeks and our months so that we make sure it's not all consuming. I mean, I have a family. I have 2 daughters that I had not during medical school, not during residency, but at my first daughter was at the very end of fellowship. Now medical students do have, start families during medical school and during residency. I didn't do that. I think it would be hard, but people do it, and it's really, I'm very impressed by it. I think that really changed sort of my whole work. I mean, once you have children, then they become, we always talk about, you're just juggling all these balls in the air, but that your family is sort of the glass ball. So that's the one that you can keep juggling, but that's the one you absolutely can't drop. And that should always be your first priority. So that was sort of my guiding mantra, I would say. And then of course I do have my dog. So that for the last 5 years has been definitely helped me with my work-life balance. And then I bring him to the hospital because he's part of the people-animal connection, and we visit patients, and I'm in a completely different role. I don't do infectious diseases in that role. I mean, I wash my hands, but I don't see patients and comment on their treatments, or I see adults and I go in and out of rooms with my dog, and I'm really a volunteer there. So that's really helped. I guess, over the last, 4 or 5 years to help even center me even more.
I don't know if I would say I've been recently trying to develop skills in work-life balance. I don't think I had them as an undergrad. But yeah, I've been trying to partition, block off time to truly take, the whole weekend off. I think now it a little bit also just reflects how much I love what I do, that I often want to work on some things that I'm excited, like projects I'm excited about on the weekend. But it is important to have a day or 2 every once in a while without anything and just unplug from email. So I love going to, I live in West LA, so some of the trails like Temescal are 15 minutes away from my apartment driving. And so just being able, actually I did it today because I'm off service, and I can kind of schedule my hours however I want on those days to an extent. So in the middle of the day, I took an hour and a half hike And then I love baking. So I bake a lot and bring baked goods to share. And my partner is also in medicine, and he's still in training right now. So I think our schedule, and I do not have kids right now. So our schedules we're kind of equally busy. And so our schedules kind of line up in that way, that we both are loving what we do and, trying to find that balance, but it's working out.
I think we have a selection bias here because all three of us are in academic medicine, which means we chose to do teaching and mentorship, and that's not something that you just turn on and off. If your mentee texts you at 7, 8 p.m. and it's urgent, then you answer. This is the life that we chose and love. If you choose to not stay in academia after medical school and residency, there are pediatric or non-pediatric jobs where it is shift work, right? It's, for example, they're similar to Sarah's job, hospitalist medicine is a shift work. I think it's 10 days out of the month where when you're on, and when you're off, you're not supposed to get pages after you've signed off for your week. So it depends on what you want. You can choose your job, and that's yeah.
Yeah, I think that's the great thing about medicine, is that you really can choose, even within a specialty, you can, depending on what your priorities are, as long as you're a little bit flexible with, you don't have the dream already in your head of like, I want to work at this exact hospital, without knowing, what the logistics of that would be. If you're a little bit open to looking around, and especially in LA, I feel like there's a lot of different types of practice settings and options. So if, a work day that ends at a definite time is super important to you, you can absolutely get that.
Well, thank you all for answering all these questions for the first portion. So now I'm going to stop the recording, and then we're going to transition to the second portion, and we'll go from there. So I'm going to stop the recording.